Hello, I'm Dr. Ruff. I've been a member of Fairfax Radiology for over 23 years. I'm specialized in abdominal pelvic imaging, and I'm part of the core of radiologists who have specialized in prostate imaging. Prostate cancer does not always cause symptoms at first, and so therefore men get screened as a rule. Generally between the ages of about 55 to 70 are the current recommendations, although if a man has a family history of a prostate cancer, perhaps at a younger age, that would be reason to start getting screened at an earlier age with your doctor. And also men with African ancestry are at an increased risk of prostate cancer, and therefore the screening is usually recommended to start in the 40s as well. In addition to the PSA, which is prostate-specific antigen blood test that your doctor may order, imaging of the prostate is quite useful. Imaging may be done if the PSA blood test is high, and that is one way to look for prostate cancer before a biopsy may be considered. The best study being MRI of the prostate gland. If we find something suspicious, that helps guide the biopsy that may be warranted by finding the tumor or potential tumor before the needle is actually placed. A prostate MRI is a commonly ordered study these days. It's an easy study to have done. It usually takes about 20 minutes. Patients go into the MRI machine feet first. There's little issue with claustrophobia. Usually there is an injection in a vein in the arm in order to see blood flow to the gland. And again, it takes about 20 minutes or so, and then the study is interpreted with results provided to your doctor and for yourself. Once the prostate MRI is finished, we pull the IV and you're free to go. You can drive yourself home. There's no restriction. One reason that your doctor may order a prostate MRI is because the PSA blood test is high or is increasing. And again, the MRI is the best and most sensitive way to detect a prostate cancer, and again to help guide the targeted biopsy so that the tumor can be diagnosed if there is one there. Treatments for an enlarged prostate vary. Usually a urologist is involved, and there may be surgical procedures that are done in order to shrink the gland. Some patients are also referred for a vascular interventional radiology procedure, an embolization of the arteries that supply blood flow to the prostate. And so these men will be seen by a vascular interventional radiologist and will often have a prostate MRI before that study is done, the embolization procedure, in order to exclude any underlying disease. The treatment of prostate cancer varies considerably depending on how aggressive the tumor is, and also taking into consideration the patient's age and other health factors. Some patients may have surgery, some may have radiation therapy, some may take medicines. So the treatment of prostate cancer varies and is complex depending on all of these factors, and imaging is definitely a component of the treatment. Sometimes patients do undergo follow-up imaging. For example, a low-grade prostate cancer that is considered low risk, patients may not have any treatment at all. But one thing they will probably have is continued follow-up blood tests of that PSA and also follow-up prostate MRI to see if anything has changed. Patients with more advanced prostate cancers will also sometimes undergo additional MRI studies as well as the nuclear medicine studies, including the prostate-specific membrane antigen or PSMA test.